So as we were learning the regulation of kidney function, that when the glomerular filtration rate lowers, it can be normalized by renin-angiotensin mechanism induced by juxtaglomerular apparatus. Similarly, if the urine becomes dilute, if the urine is dilute, in order to make it concentrated, anti-diuretic hormone can promote the reabsorption of water. So it helps in water reabsorption, and thus the concentrated urine can be produced. Urine will become concentrated. Apart from that, there is one more factor that works opposite to these two factors, that is atrial natriuretic factor. Atrial natriuretic factor is present, as the name suggests. Atrial means in the atrium. So they are found in the atrium of the heart. And this hormone acts opposite. Hormone acts opposite to the functions of juxtaglomerular apparatus. Renin-angiotensin mechanism. So atrial natriuretic factor, they become active when the blood pressure becomes too high. So when the blood pressure becomes high, if in case the blood pressure becomes high, the atrial natriuretic factor dilates the blood vessels. Dilates the blood vessels. That means expands the blood vessels. So when the blood vessel is dilated, if it's a constricted blood vessel, when the atrial natriuretic factor affects, then it will become dilated. So when the atrial natriuretic factor dilates the blood vessels, then the blood pressure will come back to normal. Blood pressure will fall down. Blood pressure will lower. So they decrease the blood pressure. Next is a topic called micturition. What is micturition? Micturition means the process of release of urine from the urethra. Process of release of urine from urethra. So the urinary bladder, as they get filled up with the urine, as it gets completely filled up, the muscles which are present here in the urethra area, they will relax, and the signals from the brain makes the voiding of urine possible, or it causes the micturition of urine. What about the other organs? There are other organs also for excretion in human beings. So role of other excretory organs. The other organs other than the kidney, they are lungs. Now lungs helps in removal of carbon dioxide. Removal of carbon dioxide, it is actually produced as a result of respiration. Carbon dioxide as well as water is removed by means of the lungs. So lungs also becomes an excretory organ. Liver is also excretory organ. They can excrete bilirubin and biliverdin. They are all bile salts. Cholesterol, steroid hormones, vitamins and drugs, means medicines. They are excreted by means of liver, that will go to the digestive system, and from there it will be removed. The next is skin. Skin, through sweat, from the sweat glands, they can remove sodium chloride, excess water, lactic acid, and even urea can be removed through the sweat. The other gland present in the skin is sebaceous glands. Sebaceous glands are secreting the oil in the skin, which is called as sebum. And sebum helps in the release of sterols, hydrocarbon, wax. So sebaceous glands also protect the skin. Now there are some disorders of excretory system. The disorders of excretory system are, one is uremia. Uremia happens when blood is having urea. Blood contains urea. If blood contains urea, the urea has to be removed, and for that a step called hemodialysis can be utilized. Hemodialysis or artificial kidney, where the patient's from the patient's blood through the artery, the blood is taken into an apparatus called artificial kidney. The artificial kidney, they have tubes. They have semi-permeable tubes called cellophane tubes. The cellophane tubes have, it is through the cellophane tubes that the blood enters. So the blood will enter into the cellophane tube, and the surrounding the cellophane tube there is a fluid. The fluid portion which is surrounding the cellophane tube is called as dialysing fluid. The dialysing fluid has got the same composition of blood, except that it doesn't have any excretory waste, or it doesn't have any nitrogenous waste. So from the cellophane tube's blood, from the blood the nitrogenous waste will get removed into the dialysing fluid. They will get removed into the dialysing fluid, and so the blood will become free of nitrogenous waste like urea. Later, this blood is returned back to the patient's body. This blood will be returned back to the patient's body, to his or her veins. So this is how we can remove the urea from the blood if there is any problem with the kidney. Or the other way how it can be solved, this problem can be solved, is by kidney transplantation. A donor will transplant the kidney, his kidney or his or her kidney, to the patient. The next is renal calculi. Next disorder affecting the kidney is renal calculi. Renal calculi means calcium oxalate salts are formed within the kidney. That is called renal calculi. Calcium oxalate salts formed in the kidney. Then there is glomerulonephritis. Glomerulonephritis means the glomerulus gets infected, and that can lead to the kidney failure also. So the above methods suggested, that is artificial kidney method or hemodialysis or kidney transplantation, can be used as treatment in this case. Now glomerulonephritis is caused due to an infection in the glomerulus.